Welcome to Jerry Chiddy MD. I'm really excited to meet you here shortly, but let's talk about the tummy tuck procedure and some common things that I talk about with every patient. I want to discuss those with you right now so that we can get down to what you're looking for specifically, and when we're looking and checking out your diastasis and what your needs are, we can focus on you. So here's some things that I typically talk about when it comes to tummy tucks. First off, what is a tummy tuck? It is actually, in medical terms, abdominoplasty. So abdominoplasty is addressing a few parts to your abdomen or your tummy, namely the skin, the fat, and then the diastasis recti, or the muscle separation. So many women have, whether it's after pregnancy or weight changes, what's called the hanging pannus, or that stubborn skin and fat that hangs down, whether it's over a C-section scar or from weight changes. There's just this skin that will not go away. Some people have stretch marks, and what I tell people is those stretch marks, it's like scar tissue. It is scar tissue, and that cannot be exercised away. Guess what? There is fat that's underneath that, and it also acts the same way. It is scarred fat. We call that lipodystrophy. And this scarred or stubborn fat will also not go away with diet and exercise. And so many times, as part of a tummy tuck, we remove that tissue, whether it's removed surgically or through liposuction. As a part of tummy tuck that I do, I include both liposuction and then tissue removal. So we'll discuss specifically what you're a good candidate for. But there are different kinds of tummy tucks. So there are full tummy tucks or standard tummy tucks. So that's the most common one. And that's typically an incision from hip to hip, very low. I keep it below your panty line or your swimsuit line so that it's well hidden. And that incision goes across low there. It's a transverse incision. And then the tissue pretty much from the belly button down to that area is removed in a standard tummy tuck. We also do what's called a diastasis repair, so the muscles that are separated after pregnancy or weight changes are brought back together with rows of several barbed sutures to keep them intact. And then the tissue is pulled down towards your pubic region, and that extra tissue is removed. Liposuction is also performed on the sides and a little bit in the upper abdomen to help give you that contour as well. And so those are the main components of a full tummy tuck. There's also an extended tummy tuck, which we'll talk about if you're a candidate for, but that's even a longer incision around the side, so even wraps around a little bit around the hips, and some people need that just to get that extra tissue out. You may have heard of mini tummy tuck and hybrid mini tummy tucks. Very few women who have had pregnancies and delivered children are good candidates for both of these, but that's something we can definitely talk about in your consultation to see if you're a candidate for that. But essentially a mini tummy tuck addresses the skin and tissue and diastasis below your belly button only. And a hybrid mini can address it above and below, but only takes out a minimum amount of skin. So we'll figure out today what you're the best candidate for. I'm more than happy to give you the different options, and we'll decide together what's going to give you the look you're going for and to help have you regain that function that you've lost.